Hi, Dr. Chan. This is a video about the instructions that you should be following right after your surgery. I've already talked to your loved ones. They've gotten the basic instructions. We've also talked about a lot of these things in our preoperative visits, but the reality is a lot of that is not retained. I just want to go over some of the things that I think would be helpful. So the first thing is everything went well. If it weren't, I would have certainly talked about it with your loved ones, and you would know by now that something didn't go right. And so if there was no conversation regarding that, things went well and you're doing great. The second thing to remember is you've just had surgery. So your body's gone through significant amount of stress. Things are not going to feel normal. You're going to feel all kinds of weird sensations, weird feelings. Those things are all normal. Really, the only things that we worry about after the surgery are the big things, such as you can't breathe. Well, although it could be anxiety, it could also be something more serious. So if that continues, I want you to call me. The other thing that we would worry about is bleeding. And if you were to bleed, one breast would be significantly larger than the other. This isn't just something, oh, I feel a little something. It's, what happened to my right breast, for example, it looks like the implant was not taken out. So short of those two things, really everything else you're experiencing is to be expected given that you've had surgery. Now, the main thing that we want to try to avoid is nausea and vomiting associated with anesthesia. The reality is, especially younger women, this is a high-risk situation, and that's one of the reasons that we use several anti-nausea products. And you just have to remember our conversation about stay with really simple, bland, boring, sick people food. I know you may have heard conflicting instructions by other people, but the reality is I just want you to stay only with things like crackers, toast, jello, broth, plain rice, bananas. That's really about it. Anything more, especially in that first 48 hours, has a tendency to create problems with nausea and vomiting. The other thing, again, don't take any medications on an empty stomach. Speaking of eating, the other thing, again, is I don't want you pushing fluid. As we talked about before, drinking a lot of fluid will not flush anything out. The stress of surgery is such that you will retain everything. All that fluid, all it's going to do is cause significant bloating, which is uncomfortable. As far as wound care, everything is wrapped up. There's nothing for you to change or clean until you come back and see me. Your family member has been given instructions on how to empty the drains. It just needs to be drained twice a day, record the amount, and again, we use that drainage amount to determine when the drains are coming out. As far as stripping drains, especially in the beginning, it's not anything you have to worry about, so just focus on keeping track of the drainage amounts. One of the things that we talked about earlier was bleeding complication. Excessive arm movements can cause that. However, it doesn't mean that your arms have to be frozen at your side. You can certainly move them a little bit, but try to remember slow, controlled movements. That way, as soon as you feel something, you stop right away and you're not going to get in trouble. Again, everything went well. There's nothing for you to worry about. Don't pay attention to those funny sensations, funny feelings, can't sleep, sleeping too much. Your body's gone through a lot, and that's to be expected. If you do have questions, call me at my office, 949-644-5000. Even if the office is closed, it will go to exchange and I'll be contacted, or the person on call will be contacted. So the worst is now over. Take a deep breath, relax, and then we'll see you on your first post-operative visit. Thank you.